The topic is gonorrhea. Gonorrhea is a bacterial sexually transmitted infection that both men and women can acquire. Some people may have no symptoms. Some people may develop abnormal discharge from the vagina, penis, and pain with urination in either men or women. Persons who perform oral sex or have anal sex may also develop symptoms in those sites. Gonorrhea can have serious consequences if it is not treated. The infection can be cured with antibiotics. It is caused by the bacteria Neisseria gonorrhea. It can spread from one person to another during oral, vaginal, penile, or anal rectal sex. A man does not have to ejaculate to spread the infection. Insertive sex toys or objects may spread gonorrhea to another person when shared between people. People cannot get gonorrhea by touching objects such as the toilet. The risk of gonorrhea is higher if the person has a new sexual partner, multiple sexual partners, unprotected sexual activity, and if the person has other sexually transmitted infections. Symptoms of gonorrhea depend on where the infection is and whether the person is a man or a woman. Because some people have no symptoms, it is easy to spread. Both men and women can develop infection of the throat, urethra, rectum. In women, infection most commonly occurs in the cervix, can involve the uterus, fallopian tubes, ovaries, reproductive system. Infection in men can spread to the urethra, can spread to the prostate, and epididymis. Oral gonorrhea can cause a sore throat, but most people have no symptoms of oral gonorrhea. In women, symptoms can include vaginal itching or abnormal vaginal discharge, vaginal bleeding or spotting, pain or burning during urination, rectal discharge or constipation, pain with bowel movements, pain with intercourse. In men, the most common symptoms include pain or discomfort with urination, milky discharge from the penis, pain and swelling in one testicle, rectal discharge or constipation, pain with bowel movements. Testing for gonorrhea usually gets done at the doctor's office. It could include a urine collection, a swab of the penis, pharyngeal, or anal rectal region. There is also home test kits available. They are not always reliable, so if you have any symptoms, make sure you discuss it with your doctor. It can be a urine sample, a vaginal cervical swab, swab of the urethra in males, oral and rectal swabs. If someone has gonorrhea, they should be tested for other sexually transmitted infections, including but not limited to chlamydia, HIV, trichomonas, syphilis, among others. If untreated, gonorrhea can lead to complications and long-term effects in both men and women, and these can include women developing pelvic inflammatory disease or PID, which can lead to infertility, increased risk of ectopic pregnancy. Men can develop epididymitis, which can lead to infertility. Both men and women can develop bloodstream infections from gonorrhea. Usually they also develop a rash, joint aches, arthritis. People with gonorrhea and sexually transmitted infections are at higher risk of acquiring HIV infection. Infection during pregnancy is important to be treated. It can affect the pregnancy and the baby. It can lead to miscarriage and premature birth. It can also be passed to the baby during delivery, which could lead to conjunctivitis and other symptoms and complications of the newborn. Gonorrhea can be treated. Lately, there's been increased resistance to the most common antibiotics that get used to treat gonorrhea. It is always important to talk to the doctor about what would be the best antibiotic treatment to obtain based on patterns of resistance in the particular areas, also allergy history, medication interactions, among others. One of the antibiotics is ceftriaxone, but there are some other antibiotic options. Sexual partners need to be treated. The person should not be sexually active until 7 days after treatment. It can recur new infections are possible. It is possible to develop the infection more than once. For prevention, doxy-PEP or the use of doxycycline after sexual exposure is an option. Also use condoms, which can reduce the probability of gonorrhea and other sexually transmitted infections. Do not have sex if the partner has any symptoms suggestive of infection, like abnormal discharge or burning with urination. I hope this topic was helpful. Thank you.